Hello everybody, this is DMA's FMGE Hacks and today we are going to talk about the orthopedics. So speaking of orthopedics, the high yield area is always a trauma in orthopedics. So orthopedic trauma contributes for 30% while non-traumatic orthopedics contributes for 17% and inflammations of your musculoskeletal system contributes for 16%. So like technically speaking, 60 to 70 percentage of the questions has been came from this area. So among the very important one is your orthopedic trauma. So we divide the orthopedics into four major regions, people. We divide the orthopedics into four major regions like anatomy and physiology, trauma and emergencies, arthritis and rheumatological disorders, and musculoskeletal disorder in children. These are the four major high yield areas we categorize the orthopedics. So among that, the very first one is your anatomy and physiology. Speaking about the anatomy and the physiology, we are having the upper limb bones, joints, and muscles and nerves of the entire upper limb and the entire lower limb. So where you have to remember that especially the distal areas are pretty important and all the named fracture related to them are very important. And then you have to understand the anatomy of your spine, that is your vertebral column, spinal cord, and nerve roots. Anatomy of your spine, vertebral column, and spinal cord, and your nerve roots. You have to remember in the case of your basic anatomy and physiology of your orthopedics. And apart from that, you should know about the histology of bone, histology of muscles and cartilages in order to have a better understanding to cover most of these areas too. Okay, so this is all about the anatomy and the physiology, people. So speaking about the next area, we are having a trauma and emergencies. So the first one is your three things you have to remember in case of trauma. There could be a possibility of fractures, and there could be a possibility of dislocation, and there could be a possibility of any soft tissue injuries when it comes for the trauma. So fracture, all the named fracture, their location and their type are used. You have to remember whether it is a simple fracture or compound fracture or comminuted fracture, where this fracture is happening. For example, if it is happening in the shaft of the humerus, then you may know that it is affecting the radial nerve injury. It may have a higher chances of injuring the radial nerve. And then you have the Smith fracture, which is a reversal of Colles fracture. And then you have this Montague fracture, and then you have this Scalise fracture, March fracture, and you have this Boxer's fracture, Bennett's fracture. These are all the named fractures of your upper and lower limb that you have to remember each and every one of them because they may ask you as a FMGE question. And apart from that, you may have a dislocation. What type of dislocation? For example, like shoulder joint, you may have a anterior dislocation, posterior dislocation, inferior dislocation, all of this type of dislocation. What type of dislocation can able to hurt what nerve? And what are the diagnosis and how do you prevent it? All of these things will be mentioned over here. And you have the soft tissue injuries like sprains or contusions or lacerations could also be discussed in the orthopedics. So the main area of interest in the case of your trauma and emergencies is your dislocations and your fractures and soft tissue injuries. Among that, the named fractures and the type of dislocation and nerve injury are pretty high yield that you should not forget. And then you have this arthritis and rheumatological disorder. Speaking about the arthritis and rheumatological disorder, we talk about the four areas here: osteoarthritis, rheumatic arthritis, gout, and ankylosing spondylosis. Okay, these are the four diseases that you should not forget, people. So osteoarthritis, rheumatoid arthritis, gout, and ankylosing spondylosis. So gout, always remember their clinical feature, diagnosis, and management, because gout is nowadays considered to be the topic of interest, people, that you should not miss. And apart from that, you have this ankylosing spondylosis. They may give you the X-ray picture of the bamboo spine. We already discussed there, discussed in the like medicine rheumatology. They may give you the X-ray picture of the bamboo spine and they may ask you what is the spot diagnosis. You have to think about the ankylosing spondylosis. And apart from that, rheumatoid arthritis, they may give you a clinical vignette based question, or they may give you this deformities which you may see it in the rheumatoid arthritis and osteoarthritis, and they may ask you as a question. So four diseases in the case of rheumatological disorder: osteoarthritis, rheumatoid arthritis, gout, and ankylosing spondylosis. You have to remember that, people. Then apart from that, you have miscellaneous topics. So this miscellaneous topics will cause us a dysplasia of your hip, congenital club foot, and Perthes disease and Osgood-Schindler disease, which we have studied in the musculoskeletal system itself. So these are kind of like a bony diseases that you have to remember, people. So these are the topic of interest in terms of your orthopedics. So orthopedics, speaking about the orthopedics, named cast, you have to remember. Okay, let's list out what are the things, minimum basic things you have to remember in orthopedics. Named fractures, named cast, and named dislocation. You have this dislocation, and named signs, and orthopedic tumor. You have to remember which one is coming from the epiphysis, metaphysis, diaphysis, diaphysis, and all those things. And what are the characteristic appearance, and their X-ray pictures are pretty important. If you cover these two, you may get 4 questions out of the 5. You may cover up to 4 questions out of 5. So this is all about the orthopedics, people. We have covered the orthopedics, and thanks for watching, and we'll come back to you with the next subject.